Welcome to Channel 7. Today we are going to interview Natalia, a doctor who has studied angiology and vascular surgery.
Our reporters are Bernat and Albert, and they are in the hospital John 23, Tarragona. Hello.
Hello. Now we're in the hospital waiting for Natalia.
Good morning. Today we will interview the Dr. Natalia Rodriguez Espinosa, who has studied angiology and vascular surgery. Hello.
Hola, buenas, ¿qué tal?
Could you tell us what's angiology and vascular surgery?
The angiology and vascular surgery is a branch of the medicine, and it's a specialty called medical surgical. That means that we deal diseases in a medical way or in a surgical way. The angiology and vascular surgery deals the pathology, which means disease, from the vessels of the entire body except the cranial and the heart one. So we deal diseases from the veins, the arterials, and the whole body. The carotids in the neck, the kidneys from the arms and the legs, the aorta from the stomach, etc.
Which are the diseases that you most commonly treat?
The arterial vessels which bring the blood and which ensure the good operation of the muscles and the nerves from the extremity. For example, in the carotids, platelets of trauma are formed and must be cleaned to prevent of being a vein emboli. In the abdominal aorta, there can be a problem of arteriosclerosis. It can be expanded or chapped. If it is chapped, there's no blood enough in the legs, and there's a problem on walking. And if it is expanded, it can get broken and producing a serious internal hemorrhage. And there can be a problem in the veins, which can be varicose veins or venous thrombosis. Basically, it's this: arterials and venous problems.
How do you treat these problems?
There are three ways to treat angiology and vascular surgery. These are through a medical treatment, which is mainly used in venous thrombosis, surgical treatment with open surgery, where we need different specialists for the good of the patient, and endovascular treatment, where we introduce the catheter without opening the skin.
And when you're operating, which are the components of a surgical team? It is very big. It's important to keep the operating room clean. Therefore, there is a cleaning team. There is a nursing team, where there is the instrumental nurse who gives you the surgical materials. The circulating nurse is there too, entering and leaving the room if we need some unexpected material, as we are operating the patient because we can't be polluted. The anesthesiologist is indispensable. Without him we couldn't operate, although in some operations we only anesthesiate a single part of the body. Of course, the vascular surgeon, and finally, there is the orderly, who moves the stretcher if necessary. A surgical team isn't the surgeon alone. We all are a big family.
Let's speak about the operating theater. Does it have any special equipment?
When we do an open surgery, we must change our clothes and dress with a green pajamas-like cape and a cap to avoid the bacteria from the street. There are different rooms which the patient must cross before entering the operating room. We also have a tap to clean our hands. Of special equipment, We use an electric scalpel, very useful if the patient bleeds a bit. The vacuum cleaner sucks out the blood if the patient bleeds a lot. In endovascular concern, we operate through a pinch. We use the catheter and with some leaders we navigate through the vessel. For this operation, we need an arch of endoscopy which produces X-rays. Therefore, we protect with clothes made up of lead. Patients get a low level of radiation, but I work there every day, so I must protect myself.
Do you have any new machine, a machine up to date?
Yes, we have modern machines. For example, the arch of endoscopy only has about 10 years. It is really new. We hope later on we'll have more, but the problem is the budget, which isn't enough. But we can't complain because we can work very well with our equipment. The new tendency is to stop using the scalpel and start treating at a percutaneous concern. This reduces the wound made by the scalpel and helps the patient to recuperate faster and better.
Do you have any anecdote or successful case to explain us?
Fortunately, there are a lot of successful cases. Some not successful cases produced because of a very serious illness. Main arteries of our body which broke down and some patients arrived dead at the hospital, or operations where the patient bleeds a lot and they have a very hard recuperation. But we work to help them the better we can. Interesting cases are, for example, patients which we can see the slow illnesses development. Cases in which there is a wound made by a blooded weapon or a firearm, or cases made by a trauma where, besides the bone, the artery is also broken and we have to repair both because the extremity don't suffer. For example, one patient has undergone a motorbike accident and came here with an elbow's luxation. He had broken down the arm's artery. We changed it, and now he feels perfect. Thank you very much for your explanations. We have learned a lot. Good luck in your job. Bye! Dr. Natalia works in 3 different spaces of the hospital. The operating theater is where she operates her patients using an open surgery. Before entering the operating room, people must change their clothes and wash their hands. There, they have a card where the different surgical tools are kept. The nurse in control is where she has the different medicines to prescribe her patients. Finally, the endovascular room is where she works using scopes. Firstly, the patient is anesthetized, then she does a scope using the arch of scopes, and finally, she introduces the catheter through the vessels to repair the patient's problem.